Tonight on Insight, the accidental addicts.
I was prescribed one, I'd take three. I needed that magic pill.
I didn't believe that anyone could know how much I needed but me.
Does there need to be tighter regulation?
I just kept trusting my doctor.
They're good drugs. They do the job pretty well.
This is not how doctors should be doing it.
I think that Xanax saved my life.
Hello, I'm Anton Enos, filling in for Jenny Brockie. Welcome to everyone here tonight. Thanks for joining us. But Jana, welcome to the show. What was going on in your life when you were prescribed these drugs in the first place?
The late 90s was a very difficult time for me. At home we had 5 boys aged between 5 and 25. I was working in a very difficult school, coordinating and teaching full-time. And I also had an elderly father who was ill and unable to look after himself.
So what were you diagnosed with and what were you prescribed?
I should say that I'm still actually on medication. I'm on a very low dose of a benzodiazepine and also a low dose of an antidepressant. It all started for me in July '99. My mother was dying in hospital. It was just after I visited her in palliative care, and I had my first major panic attack. I went to my GP and he prescribed Xanax or alprazolam. He warned me to only take it for a short time, and to the best of my memory, I think I only took it a couple of times. But I was unable to get the panic under control, and it was then that I was referred to a psychiatrist. The psychiatrist put me on alprazolam and Prothidin daily doses.
Initially, did it help? Did you see a difference?
This allowed me to go back to work. So as far as I was concerned, yes, it was working. The following year, I was still on Prothidin and alprazolam when I became pregnant with my 3rd child. And obviously I wanted to come off the drugs for the sake of the baby. My obstetrician advised that this would be the best thing to do. My psychiatrist didn't agree. When I started coming off, the symptoms I was having were dreadful, and he said, look, this is your underlying condition of anxiety and depression. You really need these drugs. You're not doing any good for the baby trying to come off them. So it was between the obstetrician and the psychiatrist. Then just before the baby was born, I decided that I wanted to breastfeed, and so I stopped the alprazolam.
And alprazolam we know as Xanax, right?
Correct. And when the baby was born, he was having fits in hospital. I didn't really make the connection, but a friend of mine who's a GP came to see me, and she said, look, it would be better for you and the baby if you resume the alprazolam, which I did. And the fits stopped.
So was there a point where you realised that this was turning into an addiction?
I just kept trusting my doctor. He said, this is what you need. It did, now that you mention it, yes, there was a time when I noticed there was a pattern to his prescribing. So every time the symptoms would get worse, he'd increase the doses, and until he got to some sort of limit where it wouldn't be safe to prescribe anymore, and then he would switch me to another drug. And I remember saying to him at one stage, there seems to be a pattern here, and he laughed.
So what proportion of cases that came before you that fell into this category of everything falling apart were related to drugs like Xanax?
In the last 5 years of my work in the drug court, it was rare for an order to be cancelled for a reason other than Xanax.
That's a pretty strong statement.
It is a very strong statement. but it's a true statement. And it wasn't heroin, it wasn't ice or amphetamines, it was Xanax that caused people to lose their order. So these drugs are very, very powerful, and the effect on the brain chemistry, I think, is what we need to be aware of. The person is no longer themselves in the sense of no longer their true self.
Well, let's get a comment from Dr. Where does the problem lie? Is it patients? Is it GPs?
I tell doctors, if you're going to do this, you have to say to someone, I can fix your anxiety today by making you a drug addict for life.
Well, tonight we're talking about prescription drugs and the risk of addiction. Nick, where does the problem lie? Is it patients? Is it GPs?
Well, we've talked a lot tonight about opiates and pain. What I think we haven't talked quite enough about is the benzodiazepines, the Xanaxes, the Valiums, the temazepams. And I think there the problem is very squarely in the lap of the GPs. These are drugs that have a relatively limited role. It's not that we should never use them, but they should be used short-term and only in very limited circumstances. And these are the drugs which are commonly initiated by GPs. And I think we, the doctors, have to be much more careful. I see a lot of patients with, as Jana went in with panic or anxiety disorder, comes out with a script for Xanax. I tell doctors, if you're going to do this, you have to say to someone, I can fix your anxiety today by making you a drug addict for life. Is that what you would like? Because that's what you're risking, because they are so good. They work superbly well, whether it's for sleep, whether it's for anxiety. But they're not going to continue to work without this high risk of addiction and escalation of use. So that's what I think we doctors have to be much more aware about and much more careful with.
Well, Ian Tong,
There should be a policy in the practice, and most of the doctors, if they are conscientious, they follow that policy.
Nika, how do you prescribe Xanax?
Well, I'm proud to say I've never initiated a prescription for Xanax in my prescribing life. I've only ever written a prescription for Xanax on the rare occasions when someone's already on the drug and I'm trying to manage their withdrawal from it. I would like to say, I think you're absolutely spot on with what you said. No, sorry, not you, this gentleman here. Because all too often what I see is that doctors do take the quick and easy route. It is, as you absolutely say, quicker and easier. I've come in with anxiety, panic, insomnia, much quicker and easier to write a prescription. It is much more professional to do what is the right thing, which is to talk to the patient to work out what the right treatments are and not start them on a lifetime of addiction.
Jana, you have very personal experience of the destructive powers of Xanax. What were you warned about when you went onto Xanax? Were you given adequate warning about how addictive this drug is?
I was given some warnings about the side effects, but these were only the side effects of initial use and not long-term side effects. Nothing about dependence and a developing tolerance, none of that.
Chrissy Morell, of course, you had a slightly different experience of Xanax. It actually worked for you, didn't it?
It did. Yes, it did. I had a fairly serious nervous breakdown about 18 years ago, and I was having tremendous panic attacks. And I called my specialist, and he said to me, well, I'm going to give you some Xanax. He said, it's a relatively new drug. I'm only going to give you 6 tablets, and I want you to call me when you're going to take them. But don't take them unless you absolutely have to, because they are addictive. And I actually only took 2, and each time I called him and said, look, I'm in a frightful state. He said, take a Xanax. Let me know how you are in the morning. He really, really monitored me, and I think that is very, very important. I haven't had another breakdown, I haven't had panic attacks, I haven't had any of those things, but I did have therapy, which I believe is absolutely the right thing to do. I think that Xanax is a particularly, well, it saved my life. I feel it saved my life because it gives you a feeling of peace, tremendous peace. I mean, even if it doesn't matter, emotional pain is almost as bad as physical pain, in my opinion. And it did give me complete peace.
A feeling of peace, Jana, we heard there. Did you experience that? Do you think that Xanax, in some sense, saved your life?
No. It suppressed my symptoms to start with, and it caused a lot more pain down the track.
Well, Anna, but where is it? Where is it? Does any GPs here have been given any information about what's happening to the system?
The direction that this has taken is all about people who are doctor shopping, people who are finding sneaky ways of obtaining these drugs which they shouldn't have. But one of your panel, Jana, has never swallowed a pill except those prescribed by her doctors at the exact doses that were prescribed for her. And she ended up at the end of 2005 practically a zombie through trusting her doctor, never questioning his expertise until she was really very, very ill. That's not the end of the story, because it took her 3 more years to find a doctor, and she was shunted out of the door by 2 psychiatrists to find a doctor willing to assist her to reduce those drugs to the level that she's at today. She's still not clear of those drugs. In 6.5 years, she has never raised her intake of benzodiazepines and antidepressants. She has always reduced them. And that's how long it takes. And I would ask the GPs here, how many of them have experience of this extremely long period that is required for somebody to come clean from the really large doses?
What about you, Jana? We know you're still on that journey.
Yes, I am.
Do you see an end point to it?
I've stopped counting the days, but yes, I'm on 0.58 milligrams of Valium and 10 milligrams of an antidepressant, fluoxetine. I've come down so far, and I'm much better. I'm myself again. I'm able to teach. It's only 2 days a week, but it's something, and I'm able to enjoy my family again. And I think I'm less of a burden on my husband than I was. So things are looking good.
Well, we have to wrap things up here, but of course you can keep talking online. We'd love to hear your views. Go to our website or look at Twitter or visit our page on Facebook.